live now?
I guess we are live now. Welcome to this session, Leveraging the Internet in Environment and Health Resilience. And I would like to also welcome Amali, who will be co-moderating. She should be online here. Do we see her?
Yes, she's online.
Okay, here. Amali has founded the Dynamic Coalition on Data-Driven Health Technologies, and we are proud to be able to moderate this session at the IGF in Norway. And so be with us. We should now be able to see the next slide. Yes. So this is our agenda. And Amali, maybe you would like to introduce the agenda?
Thank you, Jon. I will actually pass the online moderation to Joao, Dr. Joao Gomez, very quickly, but I just want to make a couple of points before this session starts. And I want everybody to think globally and integrated. And when you're making policy decisions, please think as an integrated policy-making opportunity for, and especially governance frameworks and so forth. Just want to make this very simple point. The WHO has mandated that the health matters are integral part of climate change issues. And we need to look at that from the perspective of the whole community. So an ecosystem of services, and this will include public safety, emergency, ambulance, hospitals, doctors, and citizens, and so forth. So I just want to make this very simple comment about this importance of integrating our services and how we have a tremendous opportunity with ICTs to help in this enabling of this very important situation of the climate and how humans, plants, animals are going to survive for the future. I'm going to just hand this over now to Joao, please. Joao, please take it from here.
Hello, everyone. Good to see you. I hope you can hear me well in the room. Thank you for the quick introduction and also good welcome to Lilstrom. I'm not able to be in person with you, but hopefully I can support online as well with the speakers that we're going to have online. I'll just make a brief note about the agenda. So as you can see, projected at the moment as well, we will start with some keynote introductions. We have several speakers that will join us that are not all part of the Dynamic Coalition on Data-Driven Health Technologies. So we have a diverse background of people joining us. Then we will have mostly the participants of this Dynamic Coalition sharing their thoughts on this topic on a lightning round. So we will have shorter times for each one assigned. We are also mindful of the time, and we will have everyone speaking, sharing their thoughts on that. And then I will bridge into a discussion section where the room will be open for comments, questions, or ideas from anyone, either online, which I will take care of and collect and then share to the room, or in the room itself. And Jorn will bridge the questions to the speakers and make sure that the comments have a good grounding and a good place for them to be shared. And without further notice, I will pass now the word back to the room to Jorn so that we can proceed with the agenda.
Thank you, Joao. I would like to take a quick look at our topic at resilience, vulnerability, and control in the context of leveraging the internet in environment and health resilience. Of course, we have seen that connectivity boosts resilience in the IGF. During COVID, we have seen that the internet gave us a possibility to continue lots of activities, including healthcare, telemedicine, from remote diagnostics to robot-assisted surgery. The internet kept services running when COVID hit, when natural disasters occur, when we have pandemics or political unrest, and that block physical access. But of course, the total dependence on the network also makes outages instantly disruptive for clinical decisions, supply chains, and payment systems. It also makes hospitals vulnerable to cyber attacks, as we all know. When we go a step further with large-scale health data collection, it's also a double-edged sword, meaning that population-wide datasets can strengthen surveillance, early warning, and resource allocation concerning diseases, yet the same data can establish new inequities and or hardwire old ones. Visible, for instance, in the persistent funding skew towards breast cancer research over prostate cancer studies. And just one example I would like to point out in the next slide then. And when it comes to AI, this double-edged sword will even further sharpened. AI can either propose optimal care or be used by governments or industry to triage healthcare according to opaque criteria, quietly determining who receives high-cost therapies and who is excluded. So the internet, data, and AI can strengthen healthcare resilience and resilience to environmental and challenges, but they also introduce not only additional technical vulnerabilities, but more worrying still, a hard-to-detect potential for government abuse. So let's take a look at some statistics. Here we see that the incidence of breast cancer and prostate cancer is about the same. The mortality is also about the same, but the funding is far from the same. We see the government funding is almost only half, and the philanthropic funding is even much less than half. And this is just one example. And imagine that the data and AI can be used or abused by governments to focus on specific population groups where they want to allocate more funding, and the data will make it possible to analyze exactly where such funding have an effect on the on increasing inequities. And this, of course, is a risk that we face. And these inequities will not be transparent. They will not be visible because those decisions can be made in the dark and can be hidden behind behind decisions that seem to be neutral. So just as a short introduction where there are hidden risks, and with this I don't want to extend my time further and give back to João to moderate the next keynotes.
Thank you so much, Jörn. I will move on very quickly now to June Paris. I believe she'll be in the room with you all. She's a retired specialist nurse in primary care mental health, a former MAG member at UN and Civicus, and an active ISOC and civil society health initiatives member from Barbados. So June, if you are with us in the room, I would now give you the word.
Good evening, good afternoon to everyone in the room and everyone online. My name is June Paris. As he mentioned, I am retired, but I have been involved with IT for a number of years as a nurse. I worked in Europe and all healthcare in Europe, but I would like to say in the UK, is connected to the internet and connected to healthcare systems. So I've had those experiences working in a developed country, and then I retired to Barbados. It's wasn't the same when I got there. It's not easy for them to keep up with what is happening in the first world. My colleague has alluded to some of the problems that we would have faced, mainly economics. Catching up is difficult, and we have to rely on expertise from overseas, Europe and North America. We also have to rely on experts coming in to give advice, and we also rely a lot on funding. How far does this funding go? Okay, you know, in the Caribbean, we suffer from, I wouldn't say suffer, we have natural disasters. So we take one step forward and two steps backward most of the time. Therefore, any systems that are put in place are funded by experts and expertises, people from outside, and North Americans and Europeans. We have to keep repeating this funding and spreading the resources out to accommodate all the changes that we would want to make. As you can see, that would be very difficult with limited resources. So apart from natural disasters, there's also a climate of culture. Do we really want change? Is it easy to make changes in a culture, in an island culture, where people have island, the way we think in the islands is not the same as the way we think in Europe, having the experience working in Europe. Basically, we don't really think outside the box. So there's also other problems, namely the cost of the internet, access to the internet, maintenance of internet systems, and basic use of the internet. We are in a developing world, and we have all these problems, you know. We have, as I mentioned before, we have the natural disasters, we have sargassum weed. Have you ever heard of sargassum? That is creating absolute problems on the island. Health as well as food shortages in terms of fishing. We had a natural disaster a few months ago where fishing boats were destroyed and they were unable to go fishing for a while. Therefore, the cost of living went up, health problems increased, and then, you know, it all reflects back on finances and economics. Okay, we're trying. We're making changes. We're trying to improve. We're employing experts. We're receiving funding, lots of funding, but we have to put it to good use. Therefore, where does the internet come in? How can we afford to keep up to date with all the other places in the world that are way ahead of us? So I'm thinking that we need to educate. Education is very important. We need to good use of resources. We need to improve our facilities, and we need to think ahead and plan ahead by having more research on the systems, trying to understand how to deal with these systems, and to put internet use in good use, I would say. So this is, I think I'm going to wrap up now. I think I've said everything that I want to say, and my other colleagues will add to it.
Thank you so much, June. And I believe this is a great segue as well to Jason Millar, which we have online speaking as well on this topic. I will now pass on the word to him, and I believe he can follow up on your words as well. Thank you.
Hi, good morning, everyone. I hope you can hear me. So as June would have just mentioned, we in the Caribbean have a number of not entirely unique, but definitely very in-our-face challenges. We depend very heavily on external resources, which means that any funding agency that targets us for aid will usually make us an offer, but at the same time, that offer will come with terms and conditions or a set of constraining factors that will limit the actual potential to maybe fully address an issue in a way that is fully beneficial for us based on some of the boundaries that were put in place. We have many challenges as it relates to air quality because we get affected by things like Sahara dust, which is a fairly constant flow across the Atlantic. It's a very important and natural process, but certain aspects of these processes have been enhanced by climate change. For example, as June mentioned, the intrusion of seaweed, which continues to get worse within the Caribbean region. We also have the formation of tropical systems such as Hurricane Beryl, which did significant damage to us, even though it didn't hit us entirely directly. And as June would have mentioned, destroyed much of our fishing fleet. We also have anthropogenically caused issues within our islands, such as outputs from industrial agricultural processes. Barbados is known for production of sugar, and we have many cane fields which farmers use pesticides and herbicides on to control weeds and that sort of stuff. But because of the permeable nature of our rock, that seeps into our groundwater supply. So we have a lot of individual challenges that can combine into larger challenges. And in seeking external help, we have to depend on the boundaries that are put in place by every funding agency that offers us help. And it may not allow us to fully remediate any of the issues. We also have problems with fires. There's a culture of burning in Barbados, for example, where despite having laws to regulate the hours within which you can burn and the areas in which you can burn, vast sections of open lots and other areas where there are no physical buildings are burned yearly because that's the culture, that's the pastime. And dissemination of information is difficult in this age because of things like the rise of the influencer, as opposed to cultures moving more towards embracing information from specific state sources. The internet has been used to a point by the state. I'm using Barbados as an example, but not enough to say that all of the potential for its use has been manifested. So we could have more information about proper waste disposal sites to help with our waste issue. Dumping is a very large issue in Barbados as well. And all of these things affect the soil quality due to the permeable nature of our rock. So our groundwater systems are vast, and that is within a very small surface area. So the potential for the internet to regulate public perception is very strong in Barbados, and it has not been used as well as it could. In the future, this could be changed in a more meaningful way. Sorry, I'm losing signal. Yes, it could be leveraged in a more meaningful way to make sure that people are more aware of certain aspects of governance within Barbados and policies that have been made to protect the public, as opposed to being used to spread misinformation about these same things. I think I will wrap up there.
Thank you so much, Jason. And I didn't properly introduce you, but I believe it was clear from your speech that you're working in the context of Barbados as well as an environmental professional. And it was very clear that also the problems that you shared are not just one-sided, or at least one-viewed, because June Paris had also mentioned many of the aspects that were voiced and echoed. But definitely you added a different perspective to the topic. So thank you for that. And without further ado as well, I will also introduce Henrietta Mpofu. She's a medical doctor with a strong environmental and health advocacy background and a formal focal point of UNEP's Children and Youth Major Group. So I will now give you the words, Henrietta. I believe you are with us online. You are muted, Henrietta.
Hello. Merci beaucoup.
Hear you now.
Sorry, English. Hi, and I'm Dr. Henrietta Mpofu, and as rightly introduced, I'll just touch on, solutions and prospects, looking at our topic: environment, health, resilience, and the internet, and how do these come together. Currently, I'm speaking from Dakar, and I'm at a conference, an AMNET conference, Applied Malaria Modeling Conference, and it's an epitome of how these three domains come together to solve problems. Over here, I'm speaking to researchers, and AMNET is being sponsored by the Gates Foundation to empower and equip researchers with skills to be applied in malaria modeling. Now, how does the internet come in? How does the environment come in? And how do we provide solutions in these spheres? So, for example, right, with the malaria modeling, you can find out at which point in the year you have an increased incidence of malaria, especially from the effects of climate change and the fact that malaria is a vector-borne disease. You may have an increased incidence of malaria during certain seasons. And if you're able to put in that model and be able to identify the factors that are increasing it, now you are able to, as June mentioned, allocate funding to areas that are in need. You can even subdivide it into populations that are even more susceptible. And so these are the ways by which the internet can support this, right? Now, most of the modeling, we are using data sets, right? And these data sets are sitting on servers and being accessed through cloud computing. Some of the modeling is done online, and the data sets and the information is available to researchers and interested participants or interested policymakers online. So the internet now is facilitating the combination of health resilience, just using malaria as an example, to be able to bring out solutions and to be able to implement interventions in a timely manner. If we are able to now have this data broken down and you realize that a particular population, maybe children under 5, are more susceptible, that can also influence vaccine interventions, right? The fact that we think that malaria vaccines should be given to them. And so in all of this, the internet is very integral in the area of climate, in the area of environmental health, in the area of health resilience. And I would like to end here. I'm sure there are other people that can share more wonderful experiences. But we must always remember that internet governance is integral. It supports the infrastructure on which we can not just identify problems, not just offer solutions, but also disseminate solutions, right? We talk about integrity of the data. We are talking about cybersecurity. How safe is it? How are we sure that the data has not been tampered with? How accessible is it, right? Different parts of the world, in Africa, where we have connectivity issues. So all these things come to play when we want to use the internet for good. Thank you very much.
Thank you so much, Henrietta. And also best of luck of voicing these concerns in Dakar, where you are at the moment. Thank you for finding the time as well to join. And I will also now pass the word to Alessandro Berioni. He's just like Henrietta, a medical doctor, and he's currently a chair of the Young Working Group of the World Federation of Public Health Associations. And I believe you have a presentation to share, so let's see if that also works out with you sharing the screen. Feel free.
Thank you so much, Joao, for the kind introduction. And I hope you can see my presentation. Can you?
Yes.
Still loading. We see WhatsApp conversation.
Okay, that's not good. Okay, that's not good.
Works
Let
now.
me try. I was showing now. Try again. Can you see it now? Can you now?
Not yet.
Yes.
Now it's working.
Yes.
Yeah.
Yes, it's
Okay,
perfect.
greatly. Hello, everyone. Good morning. Thanks for the invitation. And I hope you're doing fresh in Oslo. Here is boiling in Rome. As Joao said, I'm the chair of the Young WFPHA. WFPHA is the working group of the World Federation of Public Health Associations. I wanted to start addressing my presentation with this title that I think is resonate quite well with the topic that you were mentioning. So the health resilience, internet in environment and health resilience. So from the public health perspective, I wanted to center this discussion, very quick keynote speech on web and well-being. So how the net can actually enhance and threat the potential well-being and the public health in general in this really interesting era that we are living nowadays. So I will go with a quick introduction, explain some public health and the internet crossplay, some challenges and priority solutions. So introducing myself from start, I've been working with the AI and I co-founded the Italian AI Association in Medicine, working for WHO Young Innovators for Quality of Care group, which was mostly practical, innovating quality of care challenges, and finally working with the World Federation of Public Health Association. So there is a common thread around health and innovation, which I'm really passionate about. So I will go first. What is the current main activities and the main roles of the internet in public health advancement and resilience, I would say. So most of the speaker has already said it, and I would like to echo with what they've already said, but mostly the internet is enhancing, I would say, early warning system for most of the concerns, either climate-made, human-made, or so on. The remote care for the underserved areas, and for health communication, either for public health messages, information, and education. There is a but, because as many of the speakers have discussed previously, not everyone is addressed. There is a huge still digital divide that is a main concern in the public health field. Indeed, only 1/3 of the global population, only 2/3 of the global population are online and have access to internet, and 2.6 billion are not achieving actually connection because of the situation they're living in rural areas and so. So I would like also to remark the last point, the one on youth, which is the most connected people. So penetration rate of 72% compared to the general population. So as a youth group, I would like to remark that and understand how the youth people can also address the best and use at its best the internet, the web, and all the digital tools that we are daily exposed to. There are some problems, as I said before, some challenges, which is, again, the digital divide. Not everyone has access to it. For example, many of the people we are collaborating with in Africa are not always available or have chances to connect to internet. There is a huge problem with the misinformation, as we also with COVID, with the vaccination situation, with political situation, as we are seeing as well, and ethical data governance in terms of transparency, accountability of data. Again, with all the neural networks, we cannot most of the time track how the data is going. So this is very interesting to understand. And I will move to the next slide, which is one of my, I would say, core slides. Been reading recently this book, which I really recommend, is Nexus from Yuval Noah Harari. And there are 3 core parts that I wanted to share with you today because are really also resonating with the main components of health. First of all, the fact that nowadays we're not living with passive informative system, but active tools, again, neural networks. So we know we have a re-elaborated source of information, and we don't know what is all this elaboration going through. Secondly, the algorithms are mostly based on engagement drive. So they're engagement-driven algorithms rather than value-driven algorithms. And this is a key point we need to address. This is a main challenge. I personally think so, in terms of all the private generation of all the algorithms. And finally, we need to restructure global governance to digital global governance, as the UN is doing, for example, with the Global Digital Compact, with the AI governal body. But this is something that needs to be also brought to the national level to enhance the regulation around all these tools. So what we are doing as group of young WFPHA, the World Federation of Public Health Association, we have some priority actions, including the designing digital tools for equity and inclusivity, keeping this in mind, promote digital governance through frameworks and quality standards, of course, advocating as civil society, as we are not a governmental body, and finally, foster multi-sectoral collaboration across health, environment, tech, education, and so on. These are some of the achievements we have had. We do lots of education and advocacy around either UNGA, World Health Assembly, and many others collaboration, also with the Council of Europe and so on. Again, one of our critical pillars is the capacity building. So allowing people to have digital literacy and giving them ability to use the digital tools meaningfully, and also finding a way to train either the communities, the population, and the health workers through the digital tools that we advocate for. These are some of the conferences we organize around. If you want to participate, the next one is going to be September 26th in Cape Town. The QR code for registering. And another point I wanted to address is how internet is allowing people to co-create solutions, aggregating communities and civil societies and youth people, allowing a better participation to these platforms, let's say. So I'm about to end. I just want to remark the point of the innovation ecosystem. That is our strategy for addressing the current challenges in this internet sustainability current situation. The first point is enhancing bottom-up innovation to address these public health challenges, which are big challenges and are lacking also of funds, not only of innovation lately. And secondly, structure this kind of solid platform framework that can allow this innovation process to go through all these repeated steps in order to get grounded on the specific implementation, let's say, country or so. So I'm bringing you two examples. One is the hackathon we are organizing for July 2nd. In case you would like to participate, this is something that we are moving forward, shaping the future of health with several partners. And then we are launching in late July call for global ideas on social innovation, mostly AI-powered social innovation, to showcase how public health can be advanced through the cutting-edge technology again. So just to remark all these points, we would like to call for an internet that is more solidary, that can provide early action and that can also be a shared resilience worldwide. So we are put at the forefront. These are three take-home message. So youth are the forefront for the internet and the web, let's say, digital era. Secondly, innovation is essential in public health. And also we claim for a renewed digital social contract to put people and planet first before profit and engagement algorithms, let's call it so. I'm sorry for running a bit late, 1 minute or two. So yeah, if you want to connect with me or with the Young WFPHA, these are the contacts. Thank you, Joao, for the moderation, and back to you.
Thank you so much, Alessandro. And not just for the thoughts, but also for the actions that the events you're organizing, even the book recommendations that you set in here. I would probably ask you later for you to forward the presentation so that we can share these resources and have them statically available. Thank you. And also, as you also mentioned, taking into account that we are already slightly over time, and since we don't want to overrun the session, I will now bring the word back to the room. I believe we have Amado Espinosa in the room for a shorter round of comments and on the topic as well. Amado is a veteran in medical informatics and founder of Medicist. He's a key figure in digital health reform in Latin America. So Amado, you have the word now.
Thanks, Joao, and thank you very much for the opportunity to participate. Well, right now, the main purpose of this digital coalition from IGF is mainly to introduce the community. How can you participate in a multi-stakeholder model in order to integrate all these new trends in technology like AI or quantum computing into the healthcare environment and healthcare services? Right now, our focus, as Amali mentioned at the very beginning, is to approach the social factors or predisponent factors of health, which are pretty much related to the agentic resources or tools that we do already have from different training models already available at the market, in where we are trying to provide the society with the proper resources in order to manage their own well-being and their own health. Then the new trend is right now not only to prevent, but also to help the society how to improve their health and to become partners of this healthcare responsibility, which is one of the SDGs. I encourage everybody of you from the technical community to join our efforts in order to integrate these environmental medicine variables that are currently measured in different environments into the social determinants of health that are also very well observed and included into these agentic models, and also the technical community who are really deeply engaged in the neurological basis of behavior, which are already incorporated into this new computing theory in terms of how to really take advantage of AI into the healthcare arena. I thank you everybody for your interest, and please join our DC. You can see all our documents already published into the IGF homepage, and we will be very happy to share with you our ideas, initiatives, and goals for the next coming 5 to 10 years. Thank you very much.
Thank you so much, Amado. And I think I'll do exactly the same, which is to add some of these recommendations of events and event actions that the DC is taking on to the session report, where then everyone can follow up and even join if wanted. And I will now see in the room, I also saw earlier Yao Amevi Susu sitting also on the table with you. I will give him the word now. He's an internet governance advocate and a youth mobilizer from Benin, member of the We the Internet coalition. Yao, you have
Thank
the
you very
word.
much. I'm hearing myself back. Thank you very much, Joao. On this topic, I want to share perspective on the topic from a research I ran last year, starting from last year until early this year in Benin, regarding the gap between the promised health and the reality for people who are in need of the health solutions. And during the research I conducted in Benin, I found out the actually gap between the need of the people and the proposed or appropriate solution that are made available to them on a daily basis. Let's take two examples of a young 18-year-old student who is usually rely on self-medications when he's sick or go to the local pharmacy because of long waiting time at the hospitals, or maybe because of loss of trust in the medical professionals. And they seem to look for this care for them is like a last resort, so they don't trust them. And let's take a case of a father who is also a social worker who have less income, who views this crisis, financial, medical, taking care of their family as a big financial hurdles. So the first reflex in that case is to look for traditional medications, and instead of going to the formal healthcare system, which they found very expensive for them. And they these are not just unique stories. They represent the daily reality of countless family that I met during my research. And for them, resilience is about survival, is about also treatable illness like malaria, when the cost will be bearable for them. For most of them, the cost of those treatment is almost a monthly income, a monthly salary for the whole family. So those are issues I encountered. And I also saw there were potential medical help available on the ground, but there were lack of awareness about those solutions. And those solutions, when even on the ground, the professionals that are not using the solution available. And basically, most of it, what I found out is that most of the patients I interviewed during the research, they didn't trust on the solutions. And even the doctors, those that use the platform, they confirm that none of their patients are using the app. And basically, most of the barriers is deeply rooted on the lack of the human aspect of it. There is a profound lack of awareness and deeply seated mistrust in the healthcare system, extending to it on the digital tools also. And secondly, there is a accessibility gap in the app. Most of the people I interview are not really proficient in the official language French that they use. So there's a barrier also in terms of lack of a low literacy level. Thirdly, affordability remains a big challenge as well, a big hurdle. And this kind of app can't help people if they are not really offering alternative solution to the end user to have affordable healthcare. So we must design with the community in mind. The people we are designing for, we might design with them and co-create user-centered solutions that are culturally relevant and integrate local languages and local solutions for them. We must build a trust alongside digital platform, and that they need to be integrated with the public health education and awareness campaign to show the value and reliability on just solutions. We must also make sure that the solutions are affordable, especially during time of crisis, and the cost to access those digital health solutions made available must be very flexible in terms of payment, and also make sure that they offer insurance opportunity to the end users on the ground. So those are the input I wanted to bring on board to these topics. Thank you very much. Yield back to you, Joao.
Thank you so much, Yao, for giving us direct insights from the source as well on what are the issues that you see and some potential solutions or directions even. So thank you once again. I will now give the word to Uda Kihi, online with us, senior researcher in wireless and green communication from Tunisia and PhD in telecommunications. I believe you will have slides to share with us, so also feel free to go ahead and share the screen.
Thank you so much, Joe. Could you hear me?
Yes, hearing great.
Okay, thank you. Hello, everyone. Thank you so much, Joe, for this great introduction. I want also to thank all the participants for your attending our session. And let me share my screen. Hope that it will be visible. Okay. Is it visible? Is it okay? Just I will put it much bigger.
Yeah.
I put it much bigger. Okay, so thank you so much. So my today's talk will be about cybersecurity for environment sustainability. Let's start by the roadmap of my talk. I will start by the context and the challenges to understand more about the interests of this synergy between sustainability and cybersecurity. After that, I will explain more the principle of this synergy together with challenges, best practices, and I will sum up of my talk about the key interests and key points that were of my talk. So what are the challenges? So nowadays, due to rise of the problem of climate change, we are obliged to exploit ICT for measuring green gas emission. So we speak about data sovereignty and ICT for CO2 emission and measurement, and we speak about new metrics for measuring the energy consumption. So let's say that ICT is integrated and it is based in data collection of energy. But here we have a threat of attacks, the rise of attacks in energy platforms if there is a lack of cybersecurity tools. So another challenge is the rise of the use of, we speak nowadays of the revolution of artificial intelligence and machine learning. So we speak about misinformation, fake profiles, and we have also a great emerging of a new generative of artificial intelligence. So there is a threat of cybersecurity regarding the climate change. We will have different outcomes if there is a possibility of intrusion of any energy platforms or any energy algorithms. So this is another challenge is related to data energy theft, which is a risk of a reputation of companies and sustainability in general. Okay, so let's understand a bit what is a cyber sustainability principle that we will explain in my talk today. So it is the combination between cybersecurity and other principles related to protection of society, environment, and governance. Now we speak about a new protection of the planet and environment, which leads, if it is done in efficient way, we will speak about sustainability. And with the introduction of cybersecurity recommendation, we will have another principle, which is cyber sustainability. So what is that principle about? It is about the combination between different practices of cybersecurity together with carbon footprint minimization or energy consumption minimization. So in this way, we will speak about a balance or trade-off between sustainable development goals satisfaction, which leads to sustainability, together with cybersecurity practices. So in this way, we will have an alignment between cybersecurity and green tech. So it is a way of redirection of tech for both cybersecurity, our security of data protection, privacy, human rights protection, together with planet protection, environment sustainability. So here we speak about a new concept which is based in protection, which is based on specific policies to speak about cyber sustainability. We have different pillars to respect in the way to protect the environment together with data protection or human rights protection too. It is based on specific policies and recommendations. It is a redirection or redirected for people protection, whether it is related to planet, environment, healthcare, or human rights in terms of data protection and information protection, and tech solution which will be green together with respect of cybersecurity, which leads to protection of human rights, and we speak about the green policies redirected or centric for a human. So here it is a way of redirection for cybersecurity for good, for both sustainability together with human rights protection. Simple practices for energy, we can use, for example, Internet of Things or sensors for energy monitoring and security. Best practices is to monitor the functionality and operability of these sensors in a safe way. Also, another recommendation is related to redirection or empowering research labs to focus more in this synergy between sustainability together with security intersection. Here, we need a collaboration between different stakeholders and a mindset shift together with capacity building in both green practices and cybersecurity, which calls all developers, academia, environmental experts. We need all of them to sit on the table and collaborate and to state specific rules that are redirected for the benefit of the planet and human rights at the same time. So, to not waste a lot of time, let's go to the best practices and tips for sustainable cybersecurity. It's in general based in three pillars. It is a specific environment responsibility, it is a social ethics, it is a technology resilience. It means that it is a redirection for technology for both green practices and together with respect and control of a specific ethics to protect the human rights and planet sustainability at the same time. Okay, let's speak now more precisely in the impact of artificial intelligence, because nowadays artificial intelligence and machine learning are integrated everywhere, whether in cybersecurity or sustainability. But if we let them running with different kinds of data, we will have bad outcome, or we'll have a different outcome that will be a threat of our lives and a threat of the planet. But here it is should be the use of artificial intelligence algorithm should be based in a specific quality of data sets together with if we conclude or remark of any threat or risk of bias or discrimination of specific information or bad outcome, we'll have to do specific audits and tests and adding the specific data that we need that lead us to have the good outcome. So another good practices is based in the concept of the combination between the safety concept, sustainability together with cybersecurity, which is based in, first of all, we need to have simple practices such as data backup to not, in case of we have any threat or risk, we don't have a waste of all of data, but if we keep them and do the necessary backups and storage, there is no waste for us. There is no threat of reputation. We will not lost our data and repeat again the collection and waste the data and costs. And
excuse me, we have to move forward.
Okay. So let's go to best practice. Okay. So another important thing is to have inspiration from great companies and regulators or standards that are dealing with the problem of cybersecurity and convince them to state specific rules together for the benefit of the planet, such as NIST, ISO, European acts. Okay.
Thank you very much for your for your ideas. Yes, I appreciate very much. Joao, please move ahead.
Thank you so much for gatekeeping the time. I always feel like a bad person every time I interrupt someone. So thank you for doing that role, as we definitely need it because our time is short. I will now briefly introduce Frederic as well. Be mindful of the time and please keep the intervention short. Frederic Cohen is a data-driven governance advocate with expertise in IGF and WSIS. So Frederic, I'll give you the word now.
Yes, hello everyone. Dear friends, members, and all the participants. I would like to thank you all for the opportunity to express our consideration for this summit and to all the organizers. This month is a moment of meeting and exchanges, as it was promoted by DESA Voice on a newsletter with the visit of the Under-Secretary General Lee Junhua in Nice, France for the third Ocean Conference, also the fourth International Conference on Financing for Development in Sevilla, and this IGF Summit in Norway. The topic of water is a major issue to protect the planet, dealing with health and sanitation to the people, and that engaged in combat pollution everywhere. Ecology is impacted by the interaction of humanity with the environment, and mass transfers of an industrialized population make life in danger. It is a forum of openness and inclusivity that is proposed for the international community to assist and support the decision-making that apply for the global economy. Consultation of population at a large scale of calculation is a manner to examine statistics and manage with a solution. The venue is a way to present personalities around the world and transmit information about their will of communication. It was expected to make progress into recognition by the world leaders and to recall the inherited price of peace 80 years ago. This event that will make date must be the occasion to remind the work done with the MAG to advance knowledge for prevention and application of the guidelines exposed with the internet. Publications from UNDESA are an important reference for the discussion. It is supposed that every meeting should be founded by a major vote of the community, but also investment in the private sector and the engagement of member states together. We must demonstrate our commitment to improving communication for global affairs. As major goals for the nation, health, education, and climate change are often reminded for the global market as topic on the investment to develop a fair economy. It is a sector of partnership with philanthropy, where participants can be proud to offer they are volunteering. A transparent regulatory framework is needed to define an ambitious achievement in this matter. The future talk will notice the dynamic coalition and data-driven health technologies for this contribution to global effort, and it will be an important interest for the followers of the initiatives. I thank you very much.
Thank you so much, Frederick, also for gatekeeping the time. And I will very quickly now bridge into discussion. I'll just share a medical perspective. I also have some slides on the topic, but I'm also mindful of the time. I will invite everyone to leave their questions already in the chats if you have any. And I will share my screen, and I hope you can see the slides as well. Yeah, perfect. So just a very brief note on something that we are already aware of. Environmental hazards definitely do lead into health emergencies. We have reports stating that both air pollution and water contamination, just as examples, can have obvious implications on health outcomes. And surprisingly, this is a data point that I thought it was interesting to share, that 99% of the world's population is living in places where the air quality guidelines are not met, the ones set by WHO. This obviously is a burden. It can lead to conditions such as asthma, stroke, cardiovascular diseases, even cancer. And for water contamination, while we may think that we are already having good results, and we do have 73% of the population having good coverage in a safely and manageable drinking water access, it also means that the other 27% do not have so. And this may lead to diseases. It can be many types of gastroinfections, but also even cancers, for example, in the case of arsenic contamination in waters. And I wanted to bring some examples in here of initiatives that are ongoing or that happened recently that try to focus on these aspects. One of them is Brizometer, which is a mapping initiative that addresses the air quality in real time. And many applications that we currently use already consume the information provided by these tools, so we can see what are the environments where the air quality is better or worse. Then we also have the REACH project in Bangladesh, which would provide alerts to the population based on the quality and potential contamination of the water they were consuming in public wells and also in open systems. And then the SORMAS project in Nigeria and Ghana that was established and that is currently still working, trying to focus on mapping outbreaks of conditions, of diseases, and trying also to provide a response system that works in real time to alert populations, but also healthcare providers. And we know that vulnerability, as we saw based on this project, does not necessarily mean connectivity. So my one advocacy point in this intervention is for us to address the aspects of internet access, digital literacy, and inclusion in the system design, which are often lacking. So equity must be a design principle and not just an afterthought of these tools. And therefore, I really do think that we should pick up on some of these projects and leverage them into policy-aligned interventions so that we can replicate what was well done, but also that we learn from the projects that didn't work so well and try to bridge the gap or to at least solve some of the issues that were raised or found in many of these projects that leads to them not continuing over a bigger lifespan than what the funding allocates for. And without further ado, I would like to then invite questions from the audience. So I know that in the room, you may have people that have questions. I believe you can raise the hand and a microphone will be provided to you. And I will also look into the online chats to see if there's any questions popping up. Please state your name and affiliation just for context before any intervention. Even if you don't have questions, share your ideas and comments. Thank you so much.
Do we have some questions in the room? Please show hand. Yes?
There's a mic here, you can come forward.
Yeah, please come here to the microphone and speak. And please state your name and affiliation when you start.
I'm Marcelo Fornazin. I'm from Oswaldo Cruz Foundation, Brazil, researcher in public health. Thank you for congratulations for the interesting interventions we have here. I'd like to ask you about this, when we link the discussion make the links between health and environment, we see new source of data for environmental health produced through Internet of Things. And I'd like to hear from you, what do you think about the validity of this data? How can we produce and use and evaluate the quality of this data produced by several devices for monitoring environment, and how can you use this data to provide the epidemiological surveillance in healthcare scenarios?
Yes. May I? Yes, that's an important question, and I think we have to double check on the feasibility of this data. Nowadays, as our colleague mentioned, the IoT specifically dedicated to healthcare is almost in most of the countries already linked to the public health policies. And what we are realizing is it is not only to take care of the public health problems that are already available in place, as Joao already mentioned, but also how can we really help the population to improve their health? That means if they are having a fitness program, they are trying to compensate chronic diseases, and the environmental variables can play a role in order for them to help to improve these status. It's very important to integrate those kind of values or those kind of information into their personal health record and provide them with personalized recommendations, personalized guidelines, which through the use of AI and those agentic resources I already mentioned to you are already available in certain applications. The most important step to equip right now is how can we define these guidelines in our own environments, because it is not the same value which is here, for example, this beautiful country, as it is in Mexico or in Panama or in another country, in another region. Then our recommendation is, of course, to join the efforts from the World Health Organization in order to have this data regionalized, but included into the different platforms that are already available from the different regions, and that we can really provide a personalized recommendation. Thanks.
You ask about the validity, and of course this really depends on the type of data. So if you have measurements about water quality, then of course if you have a trusted laboratory, this data is quite valid. If you have indirect measurements by IoT devices, often you have to make a lot of assumptions about causes, about measurements that you can not directly measure, but that you can kind of get from direct measurements, and then those are based on assumptions, and of course they run the risk of including certain errors or even political misconceptions.
No, in that front, I would just want to add regarding how we can use those IoT solution. I think in terms of trust on the Apple solution, I think we need to come up with unified mechanism of policies so that the data collected and how they are collected are done in the same way to build trust on those data. And depending on the regions on the world, there are different methods used, but all in all, coming with unified regulations, regulatory measures, of course, to how we collect the data and scientifically proving the validity of those data. I think that will help build trust on the data, and then also we need to be able to replicate those methods and methodologies. Thank you.
Do we have do we have comments from the online speakers on this question?
I think Huda has a hand raised.
Yes. Okay, thank you so much for this question. So I want to just add that the source of data collection is very important, and the next thing is the testing phase is very important too, because if we deploy any solution or directed for healthcare, an important thing is to test it before and to judge the outcome. After that, we can commercialize it, or we can decline it, or just adjust it, or retrain new and collect new data. And this is a collaborative efforts between so technical team and medical staff. Thank you.
Thank you. Are there any further comments from the experts? Otherwise, are there further questions from the room? Do we have a question? Do we have questions online? How?
Yes, we do have a question online. I can read it out loud, and then I'll let you add your thoughts on it. The question comes from a representative of IGF Ghana, and it reads, how can nurses balance the benefits of AI-driven healthcare with the essential needs for human empathy and compassionate patient care? I would even say beyond nurses, healthcare professionals as a whole.
Can I say a few words? It's up to the individual. As a healthcare professional, you should be you should put your job. Now, you shouldn't put the job first, but you should care about the patient and empathize and know something about what you're talking about. The important thing in healthcare too is education. We have to have expert patients. So the more expert a patient is, the easier the job is. So everything that we've said today, the environment, healthcare, internet, natural disasters, it all comes down to one thing: education. And the healthcare professional in particular, that they need to be dedicated to the job and do a good job.
I can also add to what you just said, June, that especially the healthcare professionals, they need to educate themselves on the use of those emerging technology available. But in their practices, they used to make sure they create more empathy with the patient visiting them. During my research I done in Benin, I noticed that most of the trust issue come from the way they are dealing with the patient, and this creates a breach of trust between them and their patient. So creating empathy with the patient, but also educating themselves in how to combine those technology into their daily practices. So we quite effective, I think. So.
Thank you. We have a hand from Huda. Would you like to?
Yes. I want to say that any technology, whether it is based in AI or other thing, is here to complement that and to help us. But empathy is always the first thing that we should provide to any patient to let him accept any medical tool and to help him recover very fast. Thank you.
Thank you. Do we have a further question from the room? I don't see any from the room. Raudu?
I'm not sure. We don't have any question.
Maybe if then maybe I add to the last question. Studies have shown that people tend to see more empathy in AI than in human doctors. Human doctors are often stressed under time pressure, and sometimes they don't act with the empathy we would like them to act with. And of course, empathy is not just using the right words, but is a lot more. And with AI, this is limited to the right words right now. And when I look at doctors, I see a lot of doctors that have an issue with this kind of semi-educated patients that have used Google or ChatGPT for their their problems and question the authority of the doctor while not really understanding the issue. At the same time, AI can help to provide further explanation to patients. So when a patient gets a diagnosis and they have a hard time to understanding what it means, it could be provided to answer further questions that they have maybe after the doctor is gone, and they would need further answers which cannot be given by the health system currently easily.
I will also maybe add a short 30-second point, also aware of the time, on these notes, which is the fact that empathy is often therapeutic. If we think about diseases or conditions that do not have a treatment, that are incurable, empathy is often part, or the most important part of care. But we can also look at this from the perspective of, but when is it curable? Should we also spend the time and effort, taking into account that we have limited resources, empathizing with the patient or focusing on care? Obviously, the answer should be both. Not always that is possible. And healthcare results, even though they depend on both, above anything else, they depend on good results and good treatments for the patients. Empathy should always be part of it. And as you said, technology is here to help us leverage that part of care. Potentially even a replacement in the future. I wouldn't say that now that is possible. As you mentioned, it's just words, not actions. And people still know that there's not a human behind the machine. And that still counts, even if indirectly. But I would say that is still relevant. Yeah. And yeah, thank you for the time as well. And maybe we can wrap up very soon.
Yeah, we have to wrap up. Thank you. And this was already kind of a final comment from you. Thank you for your excellent moderation, João. Thank you for all that organized this session. Thank you for Amali, who was unfortunately not able to come, and who is kind of the driving force between this dynamic coalition. Thank you for all the participants here on site, online. Thank you for attending and for your interesting questions, for your interest. And we know technology, internet, AI, data provide a lot of opportunities to improve healthcare, but also they come with a lot of risks that we have to tackle and that we have to see how we can manage them in order to keep the risk low and the benefit high when it comes to healthcare and environment and how to improve resilience. So thanks a lot. And we will be at VISIS. So if you're interested in the topic, please join us again at VISIS in 2 weeks.
Thank you.